Right now, Congress has failed in its responsibility to you and to the people of Massachusetts and to the people of America. We are now months past the funding deadline for community health centers. The same is also true for the children's health insurance program.
Just the threat of the 70% cut in funding has brought many things to the table, such as hiring freezes, pausing on facility renovations, as well as reduction in staff hours and hours of operation.
70% of the children we serve are on Medicaid. A good number of them are on, have CHIP insurance. These are often children of working parents, the working poor, who themselves don't qualify for Medicaid, can't really afford private health care, but at least their children are covered.
The other piece that CHIP has a particular focus on is screening, and so we do universal behavioral health and social needs screening for all children in our pediatric department, and that's really important so that we can identify things as prevention before it becomes a big issue, help address it, and then resolve and avoid bigger things later on.
It's absolutely critical for these funding sources to be renewed and to be strengthened. We already have some difficulty in retaining and recruiting qualified staff to work in the early ed care, and so we actually need more resources than are even appropriated in this bill. So I feel it's really quite dire and quite urgent.
We have a responsibility to each other to provide these core healthcare services, to make sure that everyone has access to a first-rate doctor, that everyone has got access to the treatment that they need. You not only know people in Massachusetts, you know people in a lot of other states, and encourage them to be loud in their support of community health, to be loud in their support of the children's health insurance program, to be loud in their support for funding for behavioral health. It's going to take all of us. This cannot be a one-party issue. This is an American issue. This affects all of our children. This affects all of our seniors. This affects everyone.